Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper and the lower arch. As you can very clearly see, the upper arch has all BTRs, whereas the lower arch has only canines which are doing very well, but the doctor has requested an all on four for all these areas. Now we've started in a reverse manner. We've actually placed four implants for the doctor. We'll start with the top right one, and this is an area which it will be angled towards the distal aspect of the jaw. On this aspect, we'll have approximately good bone, relatively 10 millimeters of ridge width with 16 millimeters of height. When we move towards the implant on the upper right canine incisor region, we've got a BDR here, approximately 8 millimeters of width, 16 millimeters of height. Moving to the upper left, sorry, anterior region. Here we've got approximately, there we go, 8 millimeters of width with 14 millimeters of height. Moving to the upper left posterior implant, which is in the premolar region, we've placed them at an angle because of the sinus, which is pneumatized distal to the 5 region. Here also we've got good bone, 8 millimeters of ridge width with 15 millimeters of height. All bone in the upper maxilla is relatively D3 to D4. On the lower, we've placed straighter implants because we had the bone support to place straighter implants, and we went distal to the ventral foramen. So here we will zoom in, and approximately the lower left arch, we've got 7 millimeters of ridge width with 12.5 millimeters of height in the distal implant. The mesial implant, lower left side, the canine will be removed. We've got very good bone there, 9 millimeters of ridge width, 15 millimeters of height. The lower right canine also will be extracted, so we'll have approximately 9 millimeters of ridge width with 17 millimeters of height. And at the distal right, we'll have good bone, D2 quality bone, 8 millimeters of width with 13 millimeters of height. So the lower jaw, the posteriors have D2 bone, anteriors have D1 bone.